So for about 3 years prior to the heart attack, I wasn't going to the doctor. I just, I let life get in the way, and I let that be an excuse.
It's hard to get somebody who's feeling good and doing well to the doctor, and that has always been a problem. Just in general, medicine was always developed to help the sick, so we treat the sick.
And although I knew that there was family history of heart disease, I just wasn't, for whatever reason, going to the doctor.
The risk factors of family history, what their lifestyles are like, of course cholesterol levels, blood pressure levels, things like that. And a lot of these risk factors are not symptomatic. People can have high cholesterol, high blood pressures and not know it, and that eventually becomes a role.
Taking my health a lot more seriously. I lost a lot of weight. I quit smoking. I was working out, probably 4 or 5 times a week. And then, that was great for a while and worked, and then life started to creep in again.
Men are at much greater risk, especially younger men. And I think the risk by our statistics and what we've been doing over the last several decades indicates that the men in their early 40s start to become risk.
That day, the day that the heart attack happened, I was playing hockey. I had been to coaching my son's hockey game earlier, and we'd driven from one rink to another rink, and I played hockey, and he was in the stands. I remember the first couple shifts, then I don't really remember anything. I guess I played for another 30 minutes and collapsed on the ice.
Kirk was very lucky. His son and others dialed 911 immediately. They started CPR and used the automatic defibrillator, the AED, that was located within the rink.
But the next thing I remember is waking up in a hospital bed. The only thing I could see really was right in front of me. There was a whiteboard that said West Suburban Medical Center. It said my nurse's name, and it said the date, which was 2 days later than I remembered it being.
When Kirk arrived, we knew he was having a cardiac event, but we weren't sure what caused it. What we did know was we had to act quickly. We instituted a procedure called therapeutic hypothermia. Therapeutic hypothermia is a cooling procedure that brings the body's core temperature down. When we bring the body's core temperature down, it requires less oxygen for the body. It lets the body work just a little less in order to recover from the cardiac event.
So in this specific instance, of course, this was a heart attack, and they went to the emergency room and from there to the cath lab, and of course the outcomes are pretty good.
West Suburban Medical Center is an accredited chest pain center and primary stroke center. That means we're held to the highest standards in the country for our care in chest pain and stroke symptoms.
I was there from Sunday night until Friday, so I met a number of nurses. They were all great. The staff was wonderful.
Our cardiology group, there's 10 cardiologists and multiple other providers that all subspecialize in certain types of cardiology. So at West Suburban, we have all these services. Focusing specifically on this patient's preventive care is paramount.
After getting released from there, spent a couple weeks, with doctors and tests, just making sure that it wasn't something other than just the hereditary coronary artery disease. Once that was, cleared up, I was cleared to go to cardiac rehab, where I got to meet another great set of nurses and staff and dietitians, and found it to be a good support place. You meet other patients like yourself, and helps you kind of get into a new routine of exercise and eating right and taking care of yourself. And so it's a great way to transition into a life where I'm going to the gym 3-4 times a week. I still skate. I do all that kind of stuff. So it's great.
The problem is that we still have hundreds of thousands of younger patients that die suddenly. So this was a lucky patient that actually made it to the hospital, was helped, and will probably do very well. Once they're diagnosed, they tend to do very well with the techniques and the medications that we have to help them with.